Does your child have a food allergy or an intolerance? I'm Dr. Mansi Kotwal, board-certified pediatrician and allergist and immunologist. And today I would like to discuss one of the most common questions parents have when they come to my clinic. What is my child allergic to? The first question I ask when a parent has a concern about a food allergy is, what did you notice when they ate the food? In other words, what were the symptoms? Symptoms of food allergy can range from mild to severe and can involve a variety of body systems. You can see hives, which can be local or diffuse, cough or runny nose, lip swelling, and itchy mouth. Depending on the age of the child, they may be able to tell you or may just try grabbing their tongue or start refusing bites of the food. You can also see vomiting, fussiness in a young child, or behavior change in general. In severe cases, you can see trouble breathing, chest tightness or wheezing, dizziness, or one may even pass out. Any of these symptoms would raise concern for a food allergy. Food intolerance, on the other hand, often leads to gastrointestinal complaints. These can be stomach pains, bloating, feeling very gassy, diarrhea, constipation. For babies, sometimes parents mention stools mixed with blood or mucus. Older kids or adults may mention fatigue or headaches. While eating the food often leads to real and uncomfortable symptoms, what is happening in your body is very different than what happens when someone has a food allergy. When someone is allergic to a food, let's say peanut, for example, their body has created a protein that binds to the peanut protein once it is ingested. This binding leads to a cascade of events that ultimately end up producing the symptoms that the person feels: the hives, the itching, the runny nose, etc. When we do allergy testing, we are looking for evidence of this protein in the body. And along with the confirming history, which is very important, this diagnoses a food allergy. When someone has a food intolerance, let's say to dairy, for example, there is a very different process going on in the body. Often, this is related to the body's inability to digest or process a certain food, or one being sensitive and possibly developing a local irritation in the gut due to a food or an added ingredient. Unfortunately, there's really no validated test we have to diagnose most food intolerances. And based on what I talked about before, the allergy testing we have doesn't address the concern either. When it comes to determining food allergy versus food intolerance, history is truly the key. In cases where there is question between the two, or you are suspicious of food allergy and want to confirm it, or trend skin or blood testing over time, allergy testing is indicated. But when a history is highly suggestive of food intolerance, it unfortunately does not help us in diagnosis and sometimes can lead to a false alarm of an allergy diagnosis, given we do see false positives on allergy testing in general. In either case, whether one has a food allergy or food intolerance, food avoidance will help prevent the symptoms. In the case of intolerance, it will help prevent the gastrointestinal discomfort, sometimes the more systemic symptoms of headaches and fatigue. And in food allergy, it will help prevent the hives, the vomiting, the trouble breathing, etc. If you are worried about either of these conditions for your child, you should discuss with your doctor the symptoms, if testing or referral to an allergist is indicated, and long-term prognosis, as sometimes for both categories, these conditions may be able to be outgrown depending on the food, the age of the patient's severity, etc. I hope this video helped clarify some questions you may have had, and if you liked it, please like and subscribe below for more information to come about the world of pediatrics and allergy and immunology.